Hello everyone, myself Yas Bhaktari. I am a student of third year PPT from the Marward University, and today's my topic is MMT of the gluteus maximus muscles from the subject PFD. So before going in the detail, we will see the anatomy of the gluteus maximus, the origin, insertion, nerve supply and the action. The origin of the gluteal maximus are from the posterior gluteal line of the ilium, dorsum surface of the sacrum, sacrotuberous ligament, dorsum surface of the coccyx and the thoracolumbar fascia, and the insertion of the gluteus maximus is in the iliotibial tract, IT band, upper and the superior fibers, the gluteal tuberosity of the femur and the lower deeper fibers. The nerve supply of the gluteus maximus muscle is inferior gluteal nerve. The action of the gluteal muscles is powerful extension of the hip, external lateral rotation of the hip, assistance in abduction. Upper fiber help the stabilizes the pelvis and knees through the IT band. This is the image, and the orange color which is seen is the orange color. This area is the origin and this area is for the insertion. This is the, now we will see the MMT of the gluteus maximus, the visual step. The position of the patient should be lie prone, face downward, knee flex, bend the knee to 90 degree to minimize the hamstring activity. Movement, ask the patient to lift the thigh off the table. Hip extension. Stabilization, the therapist stabilizes the pelvis to prevent the compensatory movement. Resistance, apply the downward resistance on the posterior thigh for grade 4 and 5. For the grade 0, no contraction felt or observed. The patient position will be the prone lying, face lying downward. Knees are flexed to 90 degree. Findings, no visible movement and no palpable contraction. For the grade 1, the patient position will be prone, knee flexed to 90 degree. Therapist palpate the gluteal maximus just above the gluteal fold. Finding, the contraction felt but no hip extension movement. In the grade 2, poor, the patient position should be patient lie in the side lying with the tested leg upward, as we can see here in the image. The legs on which we have to test it will be on the upper side, and the lower leg flexed for the stability. The tested leg kept in line with the trunk and the test movement. Patient move the upper leg into the hip extension through the available range of motion, and the movement is performed in a gravity eliminated plane. MMT grade 2 criteria, the full range of motion achieved in the gravity eliminated position, no resistance applied. For the grade 3 fair criteria, the complete full range of motion against the gravity, no resistance applied. A procedure, patient lift the thigh completely off the table. Therapist only observe the movement and stabilize the pelvis. And for the grade 3, full range of motion against the gravity. And for the grade 4, as we can see in the image, the criteria, complete full range of motion against the gravity, hold the position against the moderate resistance. The procedure, after the patient reaches the full hip extension, apply the moderate downward resistance on the posterior distal thigh, continue stabilizing the pelvis. Then the result for the grade 4, full range of motion plus moderate resistance. In the grade 4, we have to apply the moderate resistance, and we don't have to apply the full resistance on the distal posterior side of the ankle. And for the grade 5 normal criteria, complete full range of motion against the gravity, hold the position against the maximal resistance. The procedure, patient reaches the end range hip extension, apply the strong downward resistance over the posterior distal thigh while stabilizing the pelvis. The patient maintained the position without breaking. And the result for the grade 5, full range of motion plus maximum resistance. In this MMT, we are providing a minimum resistance in the grade 4, and in the grade 5, we are providing the maximum resistance. Thank you.